Hello everyone. 2021 ninth question. In conventional oxygen therapy, which device will deliver highest FiO2? Yes. It is a non-breathing mask which gives the highest FiO2. First, let's see what is FiO2. FiO2 is a fraction of inspired oxygen. What does that mean? It's a concentration of the oxygen in the gas mixture of a person inhales. Okay, if a person inhales a gas, how much oxygen concentration is inhaled? That is the inspired fraction of the oxygen. The normal room air contains approximately how much percentage of oxygen? That is 21 percentage of oxygen. That is meaning is it FiO2 is 0.21. Okay, here non-breathing mask provides highest FiO2 in conventional oxygen therapy. That is, this is also a low flow device. Okay, FiO2 is 80 to 90%. The reference will differ the values, but it will give up to 80%. You can remember that. See, non-rebreather mask will produce up to 90% they have given. This is the non-rebreathing mask. Whereas nasal cannula, the flow rate is 1, 2, 3, 4, 5, 6. According to that, FiO2 will slightly increase. Okay, it can give up to 40%. You can remember like that. Just a oxygen face mask can give up to 40 to 60%. Whereas non-rebreather mask give up to 90%. The Venturi mask is a high flow fixed performance oxygen mask. It can give up to the 60% of the oxygen concentration at a rate 15 liter per minute. This is the Venturi mask. Okay. Whereas Hudson mask is nothing but a simple face mask. It is a low flow and variable performance device. So it provides variable FiO2 which is low only. Okay, which is low. The low flow is 5 to 10 liter per minute. Nasal cannula is low flow and variable performance. Flow rate is 1 to 4 liter per minute. This is the nasal cannula you can see. We have saw the high flow nasal cannula which delivers controlled humidified FiO2 of 21 to 100% at high flow rates, and the flow rate is how much? 60 liter per minute, whereas the simple nasal cannula is just 1 to 4 liter per minute, while the traditional nasal cannula can give up to 44%, which is less precise. Okay? Coming to 10th one, what is the most common cause of hospital admission after daycare surgery? It is a post-operative nausea and vomiting. That is the most common cause for admission. Okay, it is an unanticipated hospital admission, but the pain is also a most common complication, but it is an anticipated cause. So we will give opioid medications, which further increases the nausea vomiting symptoms. Okay, hence the treatment for post-op nausea and vomiting is ondansetron, dexamethasone, and transdermal scopolamine can be given. Okay, 11th one. Which of the following can be used for induction of anesthesia, maintenance, and can be safely used in endotracheal intubation? That is sevoflurane. 11th one. You can see the sevoflurane and halothane are useful. Okay, induction agent. But the sevoflurane, due to its non-pungent and rapid onset, makes excellent choice for smooth and rapid inhalational induction agent in pediatric and also adult patients. Halothane can cause H4H, that is hepatitis, and also it can cause myocardial depression, which are the major side effects. Whereas desflurane and isoflurane both are pungent, so it can cause laryngospasm. Here, isoflurane also can cause respiratory depression as well as upper respiratory irritations. Okay. Okay. So sevoflurane is the option. 12th one, what is the mechanism of action of local anesthetics? Yeah, the majority of the action is by sodium channel blocking action. Okay, 13th one, the maximum oxygen flow rate which can be kept in conventional oxygen mask. Conventional oxygen mask, how much you can keep? That is 10 liter per minute. You can see here the oxygen face mask, their flow rate is they have kept 5 to 10. So highest you can keep is 10 liter per minute. 14th one, during resuscitation, the patient received a 20% intralipid injection. Have what could have been the most probable diagnosis? Okay, you have already treated the patient, but they are asking the diagnosis. It is because of local anesthesia toxicity. It is mainly seen in bupivacaine injection, which is a cardiotoxic drug when you by accidentally when you give it to the intravascular. They immediately start CPR and defibrillate and initiate intralipid therapy. The rapid bolus of 20% IV is given and followed by infusion of 0.25 ml per kg per minute continuously for about 10 minutes. You have to give. Okay, this is 20% intralipid injection is used in local anesthesia toxicity. Okay, option is A. Thank you. Happy learning.